But Libby Garrett, I am saying 40, but actually just turned 41 yesterday, so it's hard to get into that routine of saying 41 now. But I was born with hemolytic anemia at 6 months old, and we later found out that was PKD with some genetic testing in 2009. I have been able to have a miracle baby, my little one, Bryson. He is 7. And so after having him, my PKD got worse. But over this last year, it's been a blessing to have a more structured regimen of getting blood transfusions, since I am blood transfusion dependent. So I feel like my quality of life has increased because I get blood transfusions now every 4 weeks. So that's been a blessing. Okay, so I will tell you, this is going to be a great session. It has been humbling to get to know these PKD patients and their stories and listen to all that they have endured and gone through. And I really hope that you can take away just a piece of encouragement after hearing each of their stories. So I'm going to introduce them. First, we'll start with Bianca. Bianca is 42, and she is living in Australia. She's one of the ones that has traveled the furthest. And she is married and has 3 grown kids. So Bianca, I'm going to give it to you. Go ahead.
Okay, that's on. Yep. Hi, everyone. Well, I'm probably going to get emotional because this is incredible. This is really amazing to sit up here and to have the opportunity to be in a room with so many people with PKD, and we know how isolating it can be. Don't feel so isolated today. So my name's Bianca. I live in country Victoria, about 4 hours east of Melbourne, so in a little town called Lakes Entrance. You'll just have to Google it if you want to find out where I am. I was born in a small town. Is that ringing? Is that all right? And everything seemed pretty normal at first. I was born a little bit jaundiced, but nothing to be too concerned about. But when I was 2 weeks old, Mum noticed a couple of things that just weren't right. So she took me to the doctor. I was very yellow. I was sleeping a lot. I was very tired, and I wasn't doing what a normal baby should do. So the doctor did a couple of tests, rang my mum later that evening and said, get her to Royal Children's Hospital in Melbourne, which is our country's leading children's hospital. Now, don't pack a bag, just get in the car and go. So after 2 weeks and many tests, but no results, a sample of my spinal fluid was sent to a hospital in the States for genetic testing, and it came back positive for PKD. It was obvious that I needed blood transfusions from the get-go, but the doctors were baffled, as we all know, and decided my treatment would align with the many thalassemia patients that they were looking after. I guess they decided that good enough was better than nothing. They had a dedicated ward for the thalassemia patients, so the plan was that I would be there every 4 weeks for a blood transfusion and a checkup. And that's what I did for the first 5 years of my life. My parents were told not to expect much. They said I wouldn't learn at the same level as other children. I wouldn't play sport. Don't expect grandchildren. And I'd be doing pretty well if I made my 21st birthday. So I've doubled it. Pretty good. Yeah. And I'm living my best life, like many of us in the room. What the doctors expected and what was reality just didn't quite match up. I started walking at 10 months old and was always very active. Mum and Dad had to get me into sport because they just couldn't keep me still. I swam, played tennis, and participated in athletics, and I was quite good. At the age of 5, it was recommended that I had my spleen removed. My parents were told it was a possible cure. So my spleen was removed and resulted in a transfusion-free life for 3 years. Until at the age of 8, I developed an infection. After that, it was back to monthly transfusions. And that's when the death roll started. Ugh. I've always been prone to infection. As a child, I would get pneumonia most years, sometimes twice a year, but I seemed to grow out of it as an adult. And then I became sensitive to getting sepsis. I've been septic 4 times in 15 years. The last time in 2016, I contracted a fungal infection from coming into contact with mold. It was taking such a hard toll on my body that they had no choice but to put me in a coma. I was there for 3 weeks, during which time I developed a clot in my leg, deep vein thrombosis, in both the vein and the artery. My husband had to make the really hard decision to amputate. But there was no choice. It was leg or life. And I'm still here. The DVT was found in the artery and the vein. The doctors explained that this was a very unusual occurrence. They later told me that I had sticky blood and required blood thinners for the rest of my life. I don't know if sticky blood is linked to the PKD, though after some conversations, I think I could pretty confidently say that it is. Strange fact about my amputation: since the loss of my leg, my hemoglobin has stabilised for the first time, and I haven't required a blood transfusion since. It's been 6 years. I became a mum at 19. I have 3 amazing children and 2 stepchildren, and I'm married to an incredibly supportive husband, to which I'm very grateful. I'm a senior consultant for a company called Get Skilled Access. We work with global companies like Nike, Google, and Amazon, as well as local businesses and all levels of government to improve how they interact, communicate, and provide equitable and dignified access, customer service, and employment to people with disability. It's a topic I'm very passionate about. Living with a non-visible disability for 36 years, and now a very visible disability, I understand more than ever the differences between the two. Growing up, my tiredness and exhaustion was dismissed. I was bullied for having blood transfusions in the 80s. The kids often asked me if I had AIDS. And even now, people wonder why I look yellow sometimes. I just say it's the tan wearing off. But my disabilities are definitely my superpower. I acknowledge it's not easy. But I'm proud of my PKD. It's made me the person that I am, and it's made me the people who we all are. I'm looking forward to listening to all of your stories and hearing about your experiences and learning how collectively we can make a better future for the next generation of PKDers. So I'm just going to, reiterate, Carl, get on that register thing. That sounds amazing. So thank you.
Thank you, Bianca. Just hearing her story, it's amazing, her positive attitude and how resilient she is. And it's crazy. I know many of you know, with us having PKD and we've had our spleens taken out, we do have the risk of forming blood clots, and many of us have had that. So the fact that hers was in the vein and the artery is very rare. And the fact that after her leg amputation, she has not required a blood transfusion since 2016, which is wild. Our bodies in PKD is mind-blowing sometimes.
I don't recommend getting your leg cut off.
Okay, our next speaker is Jacob. Jacob is 34 and he's actually local to Orlando. He was diagnosed with PKD at 9 months. And Jacob was actually born in New Jersey, but his parents are from Costa Rica and they moved back to Costa Rica, giving him opportunity to receive treatments in 2 different countries. So let's hear Jacob's story.
Hello, everybody. I'm excited that I have the chance to meet a lot of people with the same condition as me. I'm thankful for all the people that make this event possible. My name is Jacob Naranjo. I'm from Orlando, Florida. I'm local. I was diagnosed with hemolytic anemia when I was 8 months old and got diagnosed with PKD before I turned 1 year old. I was born in New Jersey. I moved to Costa Rica with my parents when I was 4 years old. Ever since I was born, my life has been a roller coaster with PKD and its symptoms. I'm 34 years old, but I can say that about half of my life was conditioned because of PKD. As a child, I used to receive transfusions in a monthly basis, sometimes every 2 weeks. My transfusions intervals got better after my spleen was removed at age 3. I started having transfusions every 3 to 6 months up to being able to complete 3 years without a blood transfusion. Nowadays, my transfusion intervals vary and are often related to an infection. I also had my gallbladder and appendix removed at age 12. Growing up in a small country considered by many as subdeveloped exposed me to a lot of issues, especially when seeking specialized care for my PKD. First, because of the lack of knowledge about my deficiency, and second, because of the availability of certain resources that were needed to keep me stable. At some point in my childhood, my parents found a really good doctor that cared for me and got very interested in my condition and how to help me to overcome many challenges, obtain appropriate therapy and care. I will always be grateful to her. Growing up was a bit challenging for me because my deficiency and its symptoms deprived me of many activities. And in many occasions, I had to skip school due to the infections and compromised immune system. I had to deal with negligence from providers, bullying from others because of my jaundice, and ignorance from people without the proper knowledge about my condition that made the wrong assumptions about my health. Just like the majority of PKD patients, I currently deal with iron overload in my body due to the blood transfusions. I have some iron deposited in my liver and my pancreas. My liver function and blood chemistry are very altered. As many other patients, I have been in different chelating agents, including oral and IV infusions. Once I turned 17, I can say that somehow my condition got a bit stable. My hemoglobin remains low, but don't need transfusions as often as before. The frequency of my infections has improved as well as the severity of them. I moved back to the States to seek higher education. I have been living in Orlando for the last 14 years. As an adult, the most common symptoms I experience are fatigue and joint pain. Sometimes when it's time for a blood transfusion, I experience brain fogs. One of the most common issues I come across with my condition is the eligibility for treatments, which includes insurance denials and high copays. I bet many other ones go through the same. PKD has had an impact on my adulthood because it helped me to mature, to see things from a different point of view. With as many symptoms as we can experience, I strive to be a better individual every day and avoid to let my condition limit me from what I'm capable of. My mentality goes hand to hand with my caregivers. I believe it is important to have a strong support group alongside a good specialist. I live almost a regular life and hope to accomplish many goals in the future. To conclude, I would like to thank my specialist, Dr. Mitchell Machado, and my nurse Renee, who are here. Thank you for your support, for your interest in me and my condition. To always look for the best possible outcome and treatment to provide quality of life to continue the fight.
I mean, what an honor for Jacob's doctor and nurse to be here to hear him and being local. So what an inspiration, Jacob. And one thing that I found that was unique to Jacob's story is because healthcare in the USA, it can be very tricky and expensive. There's been times that Jacob has flown back to Costa Rica to get blood transfusions because it's much cheaper than getting them here with private insurance. So it is kind of crazy what we have to endure sometimes. Okay. Our next speaker is virtual. It's Jason Blackman. He is 49, lives in Indiana, and he's married with one son. And as you can see behind Jason, he is a Lego enthusiast. So he's very talented in creating different Legos. So, all right, Jason, we'll hear your story.
All right, I hope everyone can hear me. Yes? All right. My name is Jason Blackman. I'm 49 years old. I'm from New Albany, Indiana, which is right across the river from Louisville, Kentucky. I'm the youngest of 4 kids, but the only one lucky enough to be born with PKD. I have a healthy 13-year-old son and an amazing wife who both support me like crazy. I was diagnosed at birth with CDA and I'm transfusion dependent. My childhood was filled with transfusions and doctor's visits, several times a month or monthly. When I was 7, I had my spleen removed. This was back in 1980. And I have a giant scar on my stomach. And I like to call it my shark bite. So I seem cooler than I really am. So, yeah. For the next 5 years after that, I was put on Desferal to help with the iron overload. And I had to wear this machine at night 5 times a week for 5 years. And it pumped Desferal on me and it was miserable. But I wore it on a belt and, it worked. I was never expected to live out my childhood. And in some ways I haven't, as you can tell by my vast toy collection. I played tennis, baseball, basketball, track, and ran cross country. I played drums for a pretty successful band for a long time. But at age 40, it all changed. My health declined, and I was now a single dad with full custody of a little boy. The anxiety and panic attacks were fierce. My brain and blood like to have lots of battles to see which one can make me feel the worst. And the finish line seemed pretty close. Trips to the emergency room and bad insurance caused me to sell my house and sell 152 of my Bitcoin that I had when I bought them for $13. I had to sell them before they peaked. And yeah, that really sucked. So 4 years ago, I joined a CDA Facebook group and found out about a study. I signed up for it, figuring I should help out. And then I got a shock. They did some genetic testing and it turned out I had PKD. Now, I was still a genetic unicorn, as I like to say. I just had different shoes. I was offered the Agios drug trial, and initially I was placed on the placebo. After a few months, I was transferred to the real deal, the real medicine, which I still call AG 348. My baseline hemoglobin went from 7.2 to about 8.4 now. And I still get transfused, just not as often. I joined some PKD Facebook groups and was immediately welcomed. A little less than a year or so ago, I made my first real contact with someone who also has this disease. It was Tamara. I talked to her on the phone. And after 48 years of being the only one with this disease, I found a rare sister. And after the phone call, I wept because I'm a crier. Finally, somebody truly understands what I'm going through. You know, family or supports you, but they don't really know. They don't know what, when they say they're tired too, they don't really know what our kind of tired is. I'm really grateful for each and every one of the people that I've met through my PKD groups. When the blood tests are hard and ruthless, sometimes they take 27 vials. And the MRI machine is claustrophobic and panic inducing. I think of the kids, your kids. I keep pictures of them on my phone, not in a creepy way, but in a way to gather strength when I'm having a tough time. I'm doing this like some of you that did the drug trial, and a lot of you like Carson, or, you know, Carson's gone through some stuff. And the reasons a lot of us do it isn't for ourselves, it's for the kids. So keep the pictures on there, it keeps us motivated. I look forward to the future for the kids. That's why we're doing this. I look forward to a future where they don't have needles and fatigue and yellow skin and bone pain, and a future where they can live longer. And it almost makes me feel like a part of me will live longer too. That's all I got. I love you guys. If you need anything, I'm here.
Jason, thank you. That was very good. You know, listening to him and hearing that he had to sell his house just to pay for some medical bills. And it's hard for all of us when we have to fight with insurance companies and pay those outrageous medical bills, you know, just to have life-changing treatment and blood transfusions and our inoculation. So, okay, our last speaker in this panel is Carson, and Carson is 49, living in Indiana. He's a talented artist, an illustrator, designer, and Carson has a unique story that he is going to be able to share with us, and hopefully you'll take some hope out of it.
Wow. I'm just amazed at all of you. It's 5 years ago, I never even met a PKD person. So this is like really big. I'm going to go ahead and read from here so I don't lose track. As she said, my name is Carson McGuire. I was born in 1973 in northern Indiana. And it was pretty obvious at birth that something was wrong with me. I was rushed to Riley Hospital, Children's Hospital in Indianapolis, where I was diagnosed with PKD, which was still brand new in 1973, but I was extremely jaundiced when I was born, so it was neat. They knew to test me. So I received all of my early care at Riley Hospital in Indianapolis before moving to Pittsburgh when I was about 4. And I continued my care at Children's Hospital at Pittsburgh. But while I was in Riley Hospital in Indianapolis, they did take my spleen out at 6 months old. So from 6 months on, I definitely had I had to be careful of infection and, pneumococcal pneumonia and all of that good stuff. My standard hemoglobin ran around 7. I mean, right at the line. And if it went below 7, then it was transfusion time. There was some times when I would hit the low 8s, but that was at like my peak health and moments of my life. There were certain things that were more difficult, but mainly as a kid, the most noticeable thing was that I couldn't keep up with other kids running. Like running was really hard. But that translates into a lot of like playground, gym class activities, sports, things that you just can't participate in. So, you know, a lot of times you're just sitting on the sideline kind of, you know, and that was a challenge, especially growing up yellow and all of that stuff as far as the other kids went. And I'm sure that a lot of that can't keep up thing kind of facilitated my love of art and reading and indoor activities, rainy day things. But I had several close calls and severe infections growing up as a kid. Like I said, I had my spleen out at 6 months. I had my gallbladder out in 7th grade when I was 12 years old. It caused me to miss pretty much all of 7th grade. I had a critical attack at 15, kind of danced around with sepsis and had a bone marrow shut down. And in a span of 6 hours, I went from fine to ICU. It was very, very, very scary. My dad showed up. So that's, if they called my dad and he showed up, that's how you knew it was something was going on bad. I was mostly healthy in my teen and young adult life, but I was always on the line of transfusion dependence. I started Carnegie Mellon at 16, pre-college, studying in fine art. And then after high school, I was accepted into Tyler School of Art in Philadelphia, which was a sister school to Temple University. I followed up with studies at Heron School of Art in Indianapolis and was really making my way into a successful art career. And at about 29, so this would be around 2002, my health took a dramatic shift. It wasn't dissimilar to some of the fatigue patterns I had as a kid, and it was just way more severe. My body was in pain. I was having severe cramping. I quit Heron. I was still in Heron at the time, and I quit there. And then shortly thereafterwards, I had to quit my job. And I was diagnosed with acute iron overload and hemochromatosis at that point. I had over 3 times the lethal limit for iron in my system. And I went on the Desperol treatment eventually. At the same time, it was also discovered that I had acquired hepatitis C from a blood transfusion. And of course, you know, which was not really expected to happen and, you know, to acquire in the 90s, you know, like they think I got it in the 90s. So they found that, and then due to the PKD, treatment of any kind for hep C was not available because all of the interferon and stuff like that hemolyzes your blood. So around 2005, they finally got me on chelation treatment. I was on the chelation machine for 10 hours a day for the first 4 years, and then about half that time for an additional 6. I discovered digital graphics and things, and during that first 4 years, I used a digital pen tablet for my physical therapy and rehabilitation for my hands. I had pretty much lost functional use of my hands due to the cramping in any type of artistic sense. Also, during that same time, it's just the hits keep coming, I developed a non-healing wound on my near my ankle on the outside of my heel that persisted for on and off for about 10 years. It was just an open wound from about 2006 to about 2016. I had mobility issues. I couldn't wear a shoe, all of that type of thing. And this is the same type of thing that low oxygen conditions create in diabetic ulcers and things. So my doctors didn't even know this was a symptom that could be caused by anemia. They just were like, we don't know. So that's probably why it didn't get addressed properly for so long. Right around after that, in 2016, when I was 42 at this point, I found a hepatologist that found an off-book medication and treatment that would cure the hep C without hemolyzing my blood. And in 12 weeks, I was cured of that. So that was a huge relief. That was something I wondered if I was ever gonna, get out of my system. Shortly after that, I was enrolled in the AG 348 trial. I was in the group that got the 300 milligram dose. They were we're just gonna nuke you and see what happens. And for the first time in my life, I was so over the moon, like with hope. Finally, there was something, a treatment for me. I'm sure we all kind of fantasized about this type of thing all our lives. I had still never even spoken, at the age, by the time I was in the trial, I had still never spoken to a PKD patient. Dr. Glader who was putting me through that trial, and he was amazing. And he really helped me understand my PKD in new ways and in a clinical sense, because now I had I had very few encounters with even doctors that had any familiarity with PKD other than the ones I had in children's hospitals as a kid. The AG 348 worked a little bit briefly, but overall it leveled off at like about a 1-point bonus. And it did cure the jaundice. I would have taken it just to not be yellow, honestly. But after a year, I was taken off of it, and I was told that I was put into the unsuccessful category, and I wouldn't get it anymore. I was trying to work again at that time, and I was really hoping that it was going to work. Eventually, without it, my fatigue caught up with me, and I was becoming more and more and more transfusion dependent, and my health was starting to scare me as I got older, and I started having not any medical problems, but I started worrying about my heart and just all the things. So like okay, so at this point, I'm up to Halloween of 2020 when I got on a plane and I flew from Indiana to California, where I would live for the next 10 weeks or so. And that's where I met Dr. Shaw, who you saw earlier. And I was patient 2 that she was talking about. Patient 1 in the US and her first patient that she did this with, and so far only. And I met the team, and they would be guiding me through the whole process. And this got really surreal. The whole idea of what they were about to do was very science fiction or mad science, or something, but I was very, very interested anyway. And, I dreamed of a cure my whole life. I was still afraid of the procedure. And so I started learning about it. And I learned that their goal was to develop a procedure to cure children, that this was a pediatric study. And that's when it all hit me, this whole thing. All of a sudden, in the light of like some sort of real cure, I could see and feel the weight of the full burden of living my life with PKD, which is something you don't really think about while you have it. You don't want to do that a lot of times. Sorry. as soon as I imagine kids being spared what I've gone through in my life and struggled with my whole life, I was just really moved. And that's when this whole thing became much more than just about me. And that's when I was 100% invested. Even if it didn't work, they needed the data. This gets me. It gets me.
with you. He's
You know,
getting emotional.
that's what it became about. So, okay, sorry. But I want to tell you about the procedure itself, because you've heard all of the clinical stuff, but what does that mean? What does it look like? How did it feel, right? And for me, the most stressful time was the testing to see if you're really gonna do it. Are you really gonna move forward with this? There's two major things that you have to pass criteria for. There's the base criteria, being transfusion dependent, no spleen, in the age range, and then there's your lung and liver health. I'm glad that they explained all of that, because I felt almost responsible. But having severe hemochromatosis and then hepatitis C on top of it, there was a lot of concern that I would have fibrosis or and that would disqualify. So they ran me through the MRI, and I had 16 grams of iron in my liver. And so I had to wait 8 days to get the results of a liver biopsy to find out if I would move forward. So I got to sit at the hotel for 8 days wondering if I was going to get kicked out. That was really stressful. So they did the transjugular liver biopsy, and I didn't even have fibrosis. They don't even know why, because they said I should have. So we move forward. Let's see. And I passed the lung and the breathing tests that they run you through with flying colors. All of my labs and all my other factors were within range. So we were finally 100% cleared to begin. Stem cell collection is next, and they talk about that with the apheresis lab, like they're collecting plasma. They give you a shot to boost your stem cell production, like Amogen, or I can't remember the name of it, but it's like a blood doper type thing. And this can cause bone pain due to overworking your bone marrow. I was told that if I had bone pain, just take some Tylenol, and I'm like, well, Tylenol, if all I need is going to be Tylenol, and I'm sure it'll be fine, right? I was not fine. It was not fine. I didn't get Tylenol on the way back to my hotel, from the hospital. I thought, Tylenol. And in the middle of the night, I almost called for help. It was some of the most excruciating stuff I had ever been through, bone pain wise. And I almost called for help in the middle of the night. I was getting scary with the bone pain. But first thing in the morning, I ran across the street to the CVS. I took a Tylenol, and in 40 minutes, there was no bone pain. So when they said, take your Tylenol, if you have bone pain, do it. Don't do what I did and be like, man, I'm tough. I've been through so much. So the next day, they do a blood test, and they see like where your white cell count is at. And they either give you more drug to make more white cells, or they put you on collection. Well, my white cells were off the chart after 1 day. So they collected. And then the next day they gave me more drug, and then they collected the day after that. And then in all, I went through this for 3 collections. They altered 2, and then they kept 1 collection, on reserve just in case all else failed. And so I don't have a port. I've never had a port. So they did this with the apheresis. This needle's got 1 in each arm. And, it's just like a dialysis machine type of thing. So they, so they put everything back into you once they get the stuff out. Being used to transfusions, I mean, it really wasn't that big of a deal unless you have problems with needles. There's some aches and soreness in this part, but I mean, it's nothing we're not accustomed to, I don't think. In all, we did, like I said, I did 3 collections, and those cells, the 2 collections were sent off to another lab to have the gene insertion done, where they were explaining the gene insertion with the lentivirus and all of that. Yeah, so that was done in another lab, and while they were doing that, that's when I begun the chemotherapy in order to ablate my bone marrow and prepare. So it's very time scheduled, and so I wanted to talk about the chemotherapy because that seems to be the scary thing, huh? To me, it was probably the most intimidating part. All of my experiences with people who had cancer or had close family die of cancer were also grim and scary. I'm sure we've all seen and heard what chemotherapy can do to people. It wastes away, you lose weight, your hair falls out. It's a very visual thing. The thing that I didn't add into it with my, imagining all the chemotherapy was I don't have cancer. I'm not sick from cancer. My body hasn't been fighting cancer. So it's not the same. The way, and since this is bone marrow ablation, it's not treatment for cancer, even though it's the same drugs. So, they do a really short burst, and it's not a long drawn out thing. They gave me 16 rounds of chemo in 4 days. So it's a round of chemo every 4 hours nonstop. I lost some weight. My hair fell out. I had long hair. I used to have long hair before this. And eating was a small challenge, but honestly, I only threw up one time. I got sick one morning, and like they said, they have really great drugs for the nausea, and it really does work. So anyway, I believe it was about 12 or 13 days, and my white count came back, and then the stem cells had taken hold. My hemoglobin slowly started rising. I spent about 30 days further quarantined in my hotel while I waited for my immune system to recover and my body to recover. By the time I left, my hemoglobin was in the 14s, and I had been between 14 and a half and 15 for the last year and a half or so. I believe it was a success. I mean, thank you so much to Dr. Shaw and the whole team and Dr. Glader. And I mean, all the pediatricians I had when I was fortunate enough to be born with, where I was, I'm just really looking forward to the next phases for the kids. And, and that's what my journey looked like until now. And
Yeah.
I need to wind it up. So if you guys got questions, just pull me aside.
Yes.
I could all talk about this.
Thank you, Carson. Please, please, if you have further questions, come and talk to Carson. He's happy to talk to you through his more detail of his journey. But thank you to these panelists.